the receptors and the enzyme that would reduce the excessive production of endothelin is expected to reduce vasoconstriction, and that should also reduce inflammation and other changes within the vessel. So now it's getting a little bit complicated. So endothelin not only is involved in vessels and in other areas, but this is also very, very important for the regulation of metabolic functions, which are primarily, when you talk about this, these are primarily of muscular origin. So our skeletal muscle have endothelin receptors. So almost all insulin-sensitive tissues have endothelin receptors. So that includes skeletal muscle, liver, and adipose tissues. And adipose tissues are very, very important. And of course, in the context of obesity and type 2 diabetes, they are even more important, not only because they store fat and release fat as well as secrete certain hormone, but also because they also have important roles in terms of regulating the inflammatory aspect of adipose function as well as other metabolic organs. So in lean individuals who do not have any metabolic problems, adipocytes are perfectly vascularized, so they have enough blood flow within the adipose structure. We have nice adipocytes, and you have here and there some macrophages, very few macrophages, but mostly anti-inflammatory phenotype, which is M2 macrophages. And if you take a look at that, it also has CD4 T cells, which are helper T cells. But when you have, so this is what you have when you have no disease or any metabolic dysfunction. But with the with obesity and metabolic dysfunction, the adipocytes undergo hyperplasia and hypertrophic changes, and that means they form more of adipocytes, they proliferate more, and they become bigger and bigger in size because they consume and store more and more fat. And eventually they outgrow the blood supply, and that creates a hypoxic condition inside the core. And if you take a look at this, so we have these cells within the healthy adipose tissue, but now we have CD8 positive cells, which are cytotoxic T cells. And if you take a look at this, there are other macrophages which are called M1 macrophages. We have a lot of these M1 macrophages which are extremely inflammatory macrophages. So we have a lot of immune infiltration within the macrophage structure, within the adipose structure.